Good day, Hudson Valley. I'm your host, Lisa Caslin, and welcome to our show where we bring you the best of what's happening and who's happening in Putnam, Northern Westchester, and Southern Dutchess. Today we're kicking off a four-part series about community behavioral health, and our featured expert is Putnam Family and Community Services. Today's show will cover a very timely topic and an unfortunate topic, the heroin epidemic and its pervasiveness throughout our community, particularly in Putnam County. Our guests are here to shed light on that crisis as well as give us hope for those who are suffering with this illness for recovery. I'd like to start by introducing Diane Russo. She's the Executive Director of Putnam Family and Community Services. Welcome.
Thank you.
Susan Salomone, co-founder of Drug Crisis in Our Backyard. Thank you for coming.
Thank you.
And Doreen Lockwood. Doreen is the Program Director for Chemical Dependency Treatment and Prevention Services for Putnam County Family and Community Services. Welcome. Diane, before we get into the meat of the discussion today, substance abuse, your little agency does a lot of major work in the community. I read recently that you're servicing about 1 in 12 of the county's residents. That's a pretty big number. Can you talk a little bit about the agency and some of the programs that you're providing?
Sure. Putnam Family and Community Services is the only private, not-for-profit mental health and chemical dependency outpatient treatment agency in Putnam. So that's why we serve so many people. We have over 20 programs that treat children, adolescents, adults, and families, as well as veterans and seniors. Mm-hmm. We work on site. We are at 1808 Route 6. Mm-hmm. We also have off-site satellites in Brewster, and we work as well in the schools doing prevention, which I'm sure Doreen will talk more about. And I guess someone once said we're the best kept secret in Putnam, mm-hmm. and people, say we pass, your sign all the time, but we don't know what you do. Mm-hmm. But when people need us, we are there, and we do provide affordable behavioral health services. Our biggest program is our mental health clinic, mm-hmm. where we treat over 800 people. Wow. And we have a variety of professionals that work for us, psychiatrists, social workers, nurse practitioners, nurses. In Doreen's program, we have certified counselors for mm-hmm. Substance abuse. Mm-hmm. Our PROS program, that's a very special program. We treat people who have been suffering for years with schizophrenia and bipolar disorder. Mm-hmm. And what's so special about that program, what's so unique, these are people that in the past were institutionalized, mm-hmm. that were never given hope mm-hmm. to realize their dreams. They were told, you can never go to work, you can never get married, you can never have relationships, you can't go to school. And when they come to us, and with all our programs, we say to people, what are your hopes? What are your dreams? Because we believe in recovery. Mm-hmm. We believe in wellness. We believe that every person who has mental health challenges or substance abuse problems can get better. And we believe in people until they can believe in themselves. And that's what's so important. Mm. People who would never get a job and never have a family have hope. And that's really our mission, is to partner with community agencies like Drug Crisis mm-hmm. in Our Backyard, as well as the Department of Social Services, the Putnam County Department of Health, mm-hmm. and many providers to work together so we can foster hope, not only for people that come to us, mm-hmm. but in the community as a whole. Yeah. So it's really important that people know who we are, know that our services are available, and we wrap our services around the people that come through our doors.
That's wonderful. Thank you. I know that you have a very big event coming up. It's your annual fundraiser yes. in October, right? Mm-hmm. And I think the theme this year is going to be about the drug crisis, right, yes. in large part. And mm-hmm. I know that Susan is being honored along with the other co-founders of Drug Crisis in Our Backyard. Why is this event so important this year? Tell us a little bit about that.
Well, we need to get the message out about what's happening, not only in our country, but in our community. Putnam County is one of the smallest counties in mm-hmm. New York State. Yet we have a very high rate of overdose from drugs. And we keep losing our young people, and we have to get the message out to the community, to parents, to the schools, to the kids themselves that, you know, you can die. I mean, this isn't, you know, this is not some video game where you can turn it off. You can die. And we have to educate our people, which is what Drug Crisis in Our Backyard does. And we work with them, along with communities that care, to get these messages out.
So tell me a little bit about the event in terms of where is it, who, you spoke about, I know Susan is being honored. Anything else that you can tell us?
Yeah, well, this year's focus is on, you know, substance abuse. And the event last year that we had was very successful. We honored People Inc., Steve Michio, and that is a peer-run support agency. It's hospital diversion. So instead of somebody going to the ER when they have a psychiatric crisis, they can go to a house, which is run by peers to de-escalate, and so they don't have to go to a hospital. We also recognized Deidre Smith last year, who was a recipient of our services, and she spoke about her journey of recovery, which, you know, mental health and chemical dependency is not a sexy cause to support.
Right, there's no cute puppies.
No, but I have to tell you, if you ask anyone, just go up to anyone and ask them, do you know someone who has mental health challenges? Do you know someone who has addiction? Everyone will say yes. And so we have to reduce the stigma, educate the public, and that's what we do at our events. We educate people. And so this year, we are educating them about the addiction.
And you have a new award this year, the Sid Gibson.
Yes, it's the Sid Gibson Award. Sid was a wonderful man who passed away recently. He was one of our biggest donors, and he was in recovery himself and was very open about it and spoke about his journey. And so in his honor, we created the Sid Gibson Award, and this year at our event, we will present the award to Susan and Steve Salomone, along with Carol and Lou Christensen, who formed Drug Crisis in Our Backyard. And the event is Friday, October 17th at the Salem Golf Club in North Salem.
Great, thank you. That's wonderful. So, you know, now as we kind of bridge to the substance abuse discussion, I couldn't miss the fact that Senator Schumer arrived in our county last month, and during the press conference, he declared the heroin abuse in Putnam County to be an epidemic that required federal attention as well as funding. And I know you spoke at that event also, Susan, and you know, told folks about your personal tragedy, the worst tragedy that can come out of substance abuse, the death of your son Justin 2 years ago. Can you talk a little bit about that personal journey and how it led you to co-founding Drug Crisis in Our Backyard?
Yes, I'm happy to be here, and as Diane said, we have to keep talking about it in order to reduce the stigma around drug addiction. It's the only way people are going to come forward and look for help. So my son Justin had started smoking marijuana at 16 years old, and that was his foray into drugs. That was the entree, and he fooled around with drugs until he was about 23, 24, and then we found out he was using Oxycontin, which is a very strong legal prescription medication that is prescribed by doctors for, it was originally supposed to be prescribed only for terminal illnesses, but somehow it was being prescribed for many different things, for everything, back pain and Vicodin, which is also a very strong addictive drug, was being prescribed for teeth problem. If you have a tooth pulled, the doctor's prescribing Vicodin. So he got addicted to Oxycontin and went from Oxycontin to heroin, because heroin is much cheaper than prescription medication. Prescription medication like Oxycontin is $1 a milligram, and they would take 80 milligrams at one time, an 80 milligram pill, so it's $80 for one pill, whereas heroin is $5 a bag, $10 a bag. So he became addicted to heroin, and he struggled trying to get off it for about 5 years, and he was not successful, although he did have periods of sobriety, and he was very connected with AA and treatment programs. In the end, he could not stay away from it. He would get like 7 months and then go back. It was really, really, really unbelievable, because as a parent, that's when you say, when you see them starting to slip again, it's like, what? I can't believe it. I can't believe this is happening. What do we do now? And you're afraid the household becomes very afraid of this big white elephant in the middle of the room.
Right.
And he passed away he actually had his first overdose. He had a brain injury, and he was disabled. Oh, he couldn't work. He had a movement disorder. He couldn't play his guitar, which was really his passion. But he was in there, and we knew that he was in there because he had told people, very close friends here in Putnam, that he knew he did this to himself, and how could he ever live like this? He went into a group home May 15th, because it was time for him to leave our house. He was 29. He had to find his own way, and he OD'd on May 29th. And it was terrible. And I wrote an article for the newspaper, the Mahopac News, and called Saving Justin. And Carol Christensen, Lou Christensen called me the day it came out, which was June 9th, and told me, June 14th, because Eric died on June 9th, and told me that they had just buried their son, Eric. And we got together, and then we talked about it. We were angry. I guess the strongest feeling we all had was anger.
And does the anger come from the fact that your son was able to get those drugs, or was the anger, you were angry at your son for what he did to himself?
I think it's more of, first of all, it was very much under the covers at that time. Like, we didn't even know what was going on. It was like, how could our son be using heroin? Like, now it's out, we're talking about it, and that's why we're talking about it, because we felt like we were quite alone in this problem. Really, we didn't know where to turn. So, our anger, I think, was more at a system that failed to address the fact that this was happening. Which obviously now we know that it was happening, because we hear that it's been happening since about 1999, when it became, when Purdue Pharma put OxyContin on the streets, really. When
pharmacies really started flooding the market with advertising, and sort of the game changed, right?
Yes, so we were really angry at the system. And that's when we started this as a grassroots organization to bring people out to talk about it. And we've been talking about it ever since. And we're growing in numbers, and we've got a lot of events. And we're so thankful to be honored at this event in Putnam. We were shocked, really, when Doreen told us. And we were very, very happy to be able to keep talking about it. That is our goal, to be on shows like this so that we can let people hear over and over again that this is really happening, and it could happen to anyone.
All right, thank you. So if you were to identify a type, and for lack of a better description, and I know you don't really like that terminology, but is there a sort of person, are there personality characteristics that are apparent in people who might be more likely to become addicted to drugs?
Anyone can become addicted to heroin, prescription drugs, alcohol, cocaine. Alcohol and substance abuse, dependence, and abuse do not discriminate. As Diane said earlier, if you ask anyone if they know someone who has an alcohol or drug problem, or if they know someone who has died in recent years, they will say yes. The face of addiction has changed. When I came to work in Putnam 15 years ago, our average client was probably a white middle-class male abusing alcohol and marijuana and some cocaine. Currently, our average client is between the ages of 19 and 28 and is abusing prescription drugs and or heroin. Also, the epidemic does not discriminate, though. There's a big opiate problem with women. There's a big opiate problem with older adults who begin to take medicine. As Susan had said earlier, not only was it